Hi. I'm good. I'm good. The audio, I'm not able to listen. Your audio is not.
Yeah. Now it's
Yeah.
fine, ma'am. A very good evening. How are you
How
doing?
so? I'm
Good,
good.
good.
I'm good. Let's tell me.
So let us begin the evening. A very good evening to all the mommies. Thank you so much for such a fabulous response. So many questions. At Nutrizoe, we really believe in empowering women and enlightening them with creating awareness around women issues and the topics. So this International Breastfeeding Week, we are trying to cover as many topics as we can around breastfeeding and around motherhood. To support the same, today we have with us to introduce her. Her mantra for life is knowledge is power. She calls herself a born rebel. She is the recipient of numerous honors and awards, including the fourth highest award, the honor for an Indian civilian, the Distinguished Padma Shri Award. She also holds a Guinness World Record in removing the highest numbers of fibroids in one single operation. Not only this, she was bestowed with Indian Affairs Indian of the Year Award at Indian Leadership Conclave and with the Legend Award towards the Times Healthcare Achievers. She is armed with extensive expertise in performing complex obstetrics and gynecological surgeries. She pioneered the art of laparoscopy in 90s. A very warm welcome, Dr. Manjula Anagani, all the way from Hyderabad. It's a
Thank
complete honor to have you on our platform today.
Pleasure. Solely. You've been I think you've been doing great job. I've been watching your
Thank you so much, ma'am. Thank you so much. Ma'am, why don't you share a small part of your life with us where you keep calling yourself the born rebel? As I have read your story too.
Yeah. No, I think, see, the point is when you start questioning, that's when we are labeled as rebel. Now, we have so many things. Society is another different level
I think
altogether.
there is a little glitch. Please stay.
Yeah.
Ma'am, yeah, ma'am, I couldn't hear you. I think there was some network glitch.
Yeah. So what I was trying to say is when we start questioning, we are labeled as rebel. But the question is, whom should we question? What do we question? How many issues are questioned? So question yourself first about these things, about what you want to know, what you don't want to know. Then we start questioning what is supposed to be the norm, and we make a new norm. One thing I love about people and is that memory is very short. They forget and they forgive also. So what happens is what was norm yesterday need not be a norm today or tomorrow. So we are here to make a new norms. Norm which is comfortable for us, norm which is safer for us, norm which can be reproducible and continuing. So I think from childhood that was been my mantra in the sense that why should we do things which are uncomfortable to us? Finally, it has to be comfortable for us and safer also. But there's always a questions which come because we were told to do rather than with the logical explanation. Any logical Indian would be a rebel. That's what I would say.
Definitely, definitely, ma'am. So, ma'am, would you like to share your experience of achieving one of the Indian awards, the Padma Shri Award?
Um, I think it's been like I always say, if you're destined to happen, get something, it will happen, irrespective of what you want to do, you don't want to do. So it's been always my patients who have been with us. So when it comes to doctors, we always say we need patience, we need passion, we need profit. All that is okay. But I think when it comes to doctors, the additional P, which is important, is the patience. So it's always been my patient who had lots of confidence in me, loved me to do things which I believed in. And that is very important. Just because we want to do something, they need not be done. But if we have confidence in ourselves and we put across to it properly to the patients, they will definitely agree to it because they can see the confidence with which we tell that we will come up with the best results. Patients as such want the results. They are not bothered how you do it.
Okay.
Once you say that this is the thing you're suffering from and we want to give you this near normal life, they're okay with what we do as long as it is safe for them. So that's how my journey started in the medical field. And then we started off doing so many things which were not the norm. Like I said, they were very dogmatic about so many things in science. They used to believe that it has to be rigid, like in maths. But unfortunately, fortunately, science is not maths. Science is, like I put it simply, 1 plus 1 is equal to 2 in maths. 1 plus 1, if you don't use condom, is 3 in science. So
Yes, ma'am,
that's
definitely.
it goes. So that's the thing, when we started doing all these things and we start coming up with thinking out of the box and coming up with solutions, I think things happen. So
Yes.
unfortunately, I used to always think that these things नहीं आएगा हमारे लोग ऐसे लोगों को हम लोग काम करते जाते होता वो होता. But suddenly in December of 2014, when suddenly a phone call came saying that your name has been shortlisted, I was like, that was the first time I actually sank in brain that, okay, something is there which might happen. But even when it was supposed to be announced, I was in Chennai in a national conference when I got the call. So I think destiny made it, and nobody can stop his son from shining. Whichever
Definitely.
people.
Definitely, ma'am. Definitely. So, to start our evening today, who will be a better person than you to take forward this topic? So, you have so much of experience yourself as a mother. So, let's start our beginning where a lot of mothers think that the moment we are a teenager, our breasts stop growing. Please rethink. That's not the fact. Because the complex internal structures that is needed to feed the baby, that only starts forming once we become pregnant.
Right,
Yes.
right,
So to start our topic today, which is all about how fetus and the milk gland grows in our body. And
right.
as we all know, you always divide, all the doctors, they always say 9 months of pregnancy, 3 trimesters. So let's pick up all our questions one by one with one trimester. To introduce the
However,
first trimester, it's the adventure is about to begin. So, ma'am, my first question would be: what are the early signs of pregnancy with her breast?
see, the thing is, we all know that prematurely there are people who will have this breast pain, will have soreness, and that is a signal which gives to their brain that the periods might be coming. But unfortunately, when the same signs are seen, even if your early pregnancy is there for most of them, the soreness, the breast swelling, and the tingling sensation, all these things can happen even in the early pregnancy. So what we understand is that breast tissue has hormonal receptors in it. So everything hormones, we have two hormones, estrogen, progesterone. These
Right.
two hormones are the ones which act on the receptors, and all the changes plus the sensation which we get or the soreness we get is related to that. In premenstrual time, it is the decrease of progesterone which causes these things, whereas in pregnancy, it is the estrogen which is increasing, which is a relative decrease of progesterone initially, which causes the soreness and the swelling which comes in. So, if we understand the difference instead of delaying, sometimes the relative deficiency of progesterone can lead to threatened abortion also because of the spotting. So, you have to do, all the women, unless other specified, if you're missing a date by even one day, do the pregnancy test. So, the first sign symptom can be even before the pregnancy test comes positive.
Okay.
So it can be the breast soreness and the pain in the breast and the swelling, feeling of fullness in the breast.
Definitely. So, ma'am, moving on to the next question: why breasts become lumpy and ache during the first trimester?
Yeah, we just were talking about the hormones. We are women because of hormones. I would say that we are lucky, born lucky because of hormones. So the reason I'm saying that is our memory, the way we know we have less fractures. We do not, we fall down, we get up and work. Where our patience, our brain, the type of patience we all have, the type of compassion we all have is because of the hormones which are really very nice. The skin which glows, the hair which is there, everything because of hormones. When so many good things are happening with hormones, same way, we procreate life, we give life. So for giving life, the bread and butter for the baby is milk. So we are making everything ready, which has to be easy to feed the baby. So what are the hormones? Like I said, it is estrogen and progesterone. So these start acting on the breast tissue. So when this starts happening, what happens? We have estrogen, which causes hyperplasia. What do you mean by hyperplasia? Their cells start multiplying. Means the duct cells, the ducts which are there, will start forming more and more, so that the milk which is produced can go through that to the baby. The progesterone causes hypertrophy, means the cells which are formed by estrogen, the size increases because of progesterone. So as the pregnancy goes, you see the breast size increases. What we need to understand is pregnancy is a time where there is highest peak estrogen and progesterone. So because of these hormones and the synchrony because of the hormones, we have the breast size which is increased, the ducts which become dilated, and milk which starts getting produced by the glands which are being stimulated by the progesterone, and they're ready to feed, ready to secrete, ready to anything. So as it comes, like we spoke about 9 months, so it takes a whole 9 months to become the mature. So initially, the increase in size, increase in the ducts is the one which causes this pain and soreness.
So I think
Because
there are a lot of
one
moms.
more,
Yes,
one more thing I have to tell you. Remember something. Everything has nerve ending, right? Every cell
yes.
is covered by a nerve. So when it stretches, the nerve gets stimulated and the pain can be there. So remember that.
So I think there are a lot of mothers, they are like your God for them, they are in love. So there's one question which I'd like to take, which is related to our first trimester. Hi doctor, my HCG levels on 31st was 31.25 ml and on 4th it was 10.13 ml. What should I consider
Hmm.
that as, positive or negative?
It is biochemical pregnancy. That's it. Means, what does biochemical pregnancy mean? It means that pregnancy test is positive, was positive, but it is declining, is going to become negative the next day you do it. See, anything more than 10 is going to be positive in the urine pregnancy test. But for the scan to pick up, or when we talk about a sac or anything, it is 1500. So 30 coming down to 10 means it's going to be negative. Biochemical pregnancy means the baby fertilization has happened, but it has not nidated. Means it has not अच्छा खासा नहीं बैठा है. That
Okay.
only shows rest of the things are all normal. ये बच्चा बैठते बैठते गिर गया. Nothing to worry. Next time you're going to become pregnant. Relax.
There's a mother who's asking, can you save this please? So let me inform all of the mothers, all these shows that we are doing from last week, they all are saved on our platform, Nutrizoe. You can go and check our IGTV section. So moving on to the next question, ma'am, can you please elaborate what is the tail of Spence?
Okay. See, what we need to understand, we think that what we are is the way that God has made us. No. The breast originally starts, then it migrates down. Okay. So the position where we see, so a chest bone is not where the breast is formed initially.
Right.
So when it starts migrating down to the chest area, there is the initial thing which is left over there that is called tail of Spence. Okay. So most of the people, it does not, it's just there, does not help cause any problem to them or anything. But few people during the lactation time and the pregnancy time, the breast tissue, which is little bit left over in the axillary tail, what we call as, or tail of Spence, will start growing under the influence of hormones. So they develop the axillary tail. Now, cosmetically, it might be little ugly, but otherwise, it doesn't do any harm. Nothing will happen. So don't worry, relax. But if you're worried, after your lactation is over, you can go to a plastic surgeon and get a liposuction done there.
It is very, very easy. Yes. So, moving on to the next one, skin becomes very sensitive. You can see your veins. Why?
Right. The one we have to understand in pregnancy, there's a circulation which changes. Circulation, when I say the blood supply. For our body, the uterus is a vestigial organ. It is useless accordingly because, and the baby which is growing is a parasite. So we do not, our body, our brain does not think it has to send blood to the uterus. So what happens? By nature, the blood pressure falls so that by low pressure blood flow automatically goes towards the uterus. So the blood vessels dilate. All over the body, there is dilatation, vasodilatation. And the breast tissue is increasing, engorging, becoming bigger. Vasodilatation happens. So the skin which is stretched is becoming thinner. So through that, we can see the bluish blood vessels which is there. So this is combination of increase in breast size, thinness of the breast skin, plus the circulation which is increasing with more force so that the baby. So you know that anything with pressure will show up. So that's why the blood vessels are seen very clear.
It's very clear. So before I move on, and there are a lot of questions which is coming from the mothers, I love to take them first. Yes, ma'am. So how thyroid affects pregnancy?
We need to understand both hyper and hypo also affect pregnancy. But the commonest being there is always a nexus between the brain and the ovary. That is what we call it as hypothalamo-pituitary ovarian axis. See, if you're stressed, your periods can come fast. If you're stressed, your lactation can stop. If you're stressed, your periods can stop. Anything can happen. So that finesse is there for now. In from the pituitary, all the endocrine organs function. Means the thyroid, the cortisol, that is the adrenals, the pancreas, everything is under control of pituitary. Hypothalamus is where the thought process comes. Then pituitary is where all these hormones secrete. So they're all interlinked. And thyroid and prolactin, they're all one step below. Okay, they're all interlinked. So because of us interlinked, when there's hypothyroidism, there is decreased progesterone. So you can have an abortion, you can have infertility, and you can also have abortions if you have antibodies developing. So, and if thyroid is not under control, your baby can also develop hypothyroidism if the antibodies that will lead to for the baby's mental health. So you don't have to worry about all this. All these problems come if you are not detecting and if you are not correct. So you need to immediately first trimester we do the thyroid test. If it is less, we correct it. In pregnancy, the thyroid which has to be normal is less than 2.5. Regular people up to 5 is normal. In pregnancy, we want it to be less than 2.5. This is what you need to.
So the next one is, hi ma'am, I'm third trimester. While eating, metallic smell is coming. Is anything wrong or any problem?
Don't worry about it. Different odors, different common come in this thing. But remember, sometimes iron deficiency will lead to pica and metallic smell. So get your ferritin level done. And if it is low, get it. Sometimes deworming also helps because when there are small hookworms that can cause the unknown, what we cannot see, the blood loss, that can cause ferritin to be low, and that also can cause. Third, your medicines. If you're taking iron content medicines, that also can cause metallic. So don't worry about it. But most important is a dehydration. Cause so always keep yourself hydrated. That will keep you better.
So the next one is, hi ma'am, my age is 22. I have low AMH. What is the solution? I went to IUI and negative.
Okay. First thing is, first relax. There are two parameters which are important for ovarian reserve and fertility. One is AMH, one is AFI. That is follicular index. Okay, that is what is called. We look at the how many follicles you have on the second day of the period. Okay, so when you do this follicular index, if you have good follicles, that is enough for you to conceive. AMH is the reserve. Antral follicular count, AFC, what we call it as, is the present status. Reserve means how many eggs are left over in your ovary, which can be utilized. At a particular time, you have, by the time in the menopause time also, you have 1,000 eggs which are still hidden inside. We need one egg to become pregnant or two eggs at the most. So relax about it. But think how much is the AFH? That's what antral follicle AFC that count, and FSH and LH. If your FSH LH on the day 2 of the period is normal, don't worry about AMH. Just go get pregnant. And that AMH only shows that you might have a premature menopause, means early menopause. For that, we will take care later. And if still you feel you are worried about it, there is a procedure called ovarian rejuvenation, utilizing autologous bone marrow stem cell and CRP. That will help in the ovarian follicles coming and you becoming pregnant. So at 22, your time is to enjoy and relax. Rest.
Right, ma'am. So the next one is, how Marina works on endometriosis after laparoscopy surgery.
Right. Endometriosis is like cancer, but not cancer. It's a benign disease, but it's a progress. And why do we say cancer? Because we never talk about cure. We always talk about suppressing it, remissions, and relapses. So our aim of endometriotic surgery is remove the whole disease completely, what the eye can see, and the microscopic ones which we cannot see, we want to suppress it lifelong. Means we want the disease to be to never come back again, so that your life becomes a living hell. So we want your quality of life to be decreased. So why is it possible, and how is it possible? Because endometriosis again is a hormone dependent mass disease. So what do we see here? We see it is a estrogen, which okay, actually not. It is a relative increased estrogen. It is which is causing it because of the enzyme problems which we have. And endocrine disrupting chemicals which we are getting exposed to nowadays because of plastics and the diet we eat are the ones which are increasing the endometriosis so much. And that is going to be ongoing. We are going to live in a world of plastics. We are going to live in a world of pollution. So we have to do something to not to allow this to worsen. So what do? We give some medicine which will continuously be giving low amount of progesterone to you, either in the form of Dynogest or Ocipils or Mirena. What is Mirena? Especially when it comes to rectovaginal endometriosis, we advise Mirena. Mirena is the intrauterine device which releases progesterone every day, 20 grams. So it is put inside the uterus. It's a small copper T-like thing. 5 years to 7 years it will work. Every day it releases. Locally it more. The local pain which you have will come down drastically. The pain reduction will be as high as 95%. Abnormal bleeding will come down as high as 95 to 90%. Recurrent rates are very much decreased. So you don't have pain during motion, you don't have pain during periods, your amount of bleeding will come down. 30% of people, you're amenorrheic, you won't bleed also. So you don't have to worry. Tina is like a moon. Changed the perception of patients and the doctors so much that we have avoided hysteria for many patients.
So today's mantra is there's nothing to worry when you are there. Yes.
Solution at the end of everything. There is nothing which is not, which is impossible. It is
Right,
possible.
right. So there's this mother, Poonam, she's asking, I'm breastfeeding mother and I have suffered thyroid problem last 5 years. Will this affect my child?
As such, if you just, one thing is thyroid can be, we are not saying that. But if your thyroid was under control throughout pregnancy, usually it does not affect. But after baby is born, after 1 week, blood test is done for the baby also to check. The reason that antibodies can check the placenta and that can cause any effect on the baby. But usually it does not affect the baby at all. But again, like I said, if genetics is there, keep a watch on the baby as she or he grows. Now, there should be genetics themselves will not never cause havoc unless there is an incident thing which happens, something to instigate it. So that is what is called cofactor. We have to have a cofactor to start and instigate it. It can be sudden weight gain. It can be pregnancy which can precipitate it. It can be again endocrine disrupting chemical. So if you lead a healthy life, regular exercises, see that you do not put on weight, that baby should be fine. Just relax.
So, ma'am, does the COVID vaccine affects the pregnancy?
The vaccine as such will not affect the pregnancy. And I always tell my patients, and we have been very vocal about this, that you need to live to think about pregnancy first. You need to live to think that you will stay as mother for the thing. And vaccines are primary prevention. Primary prevention is not after the disease comes. It is prevent the disease from coming and affecting you badly. Yeah, it is like an umbrella. It will not stop the rain from coming. Rain will come, but it will not make you wet. So if you take the vaccine, even if you get the infection, you will survive and you will become normal very fast. And the antibodies which you develop because of vaccine or because of infection will cross the placenta and save your baby from getting the infection and getting affected. So take your vaccine irrespective of the month of the day, irrespective of month of pregnancy, irrespective whether you are lactating or not. Just go get yourself vaccinated.
So, is there anything to worry about baby health with polyhydramine with AFI index of 22 at 28 weeks?
See, normal AFI is about 8 to 18. Anything more than that, we call it as polyhydramine. Now, there are so many reasons why it can increase. One, basically divide it into three. Baby causes, mother causes, placental causes. Mother is the most common thing to have, that is diabetes. Probably you have developed diabetes in pregnancy, get yourself checked. So that is the first thing, get yourself GTT done. So if it is abnormal, keep the sugars under control, Leica will come under control. Second, like I said, if there is a baby abnormality, then it can happen. So your TIFA scan must have ruled out abnormalities of the child. So recheck that the baby is normal. The baby is normal, then you don't have to. Then placenta, if there's a chorioangioma and any thing like that, inflammation of the chorion, it can happen. It is like crying. So if everything is ruled out, it is idiopathic. And only thing is, it can precipitate preterm labor because it becomes heavy. So just take care. Be moderate rest for most of the time. Don't lift sudden weights so that the water comes out and it comes to be preterm labor. But rule out the cause for hydramnios. If it is under control, nothing to worry. If it's idiopathic, nothing to worry.
Nothing to worry. Definitely, ma'am. So, all other questions, ma'am, I request all the mothers to keep pouring their questions. Let's come back to our second trimester and move to our same topic. So, the second trimester is the time where mother starts thinking that they have to eat for two.
Yes.
Yes. So, the first question that is coming from trimester 2 is when milk ducts are developed and the milk producing cells become active.
See, the first trimester itself, breast tissue starts developing. Areola starts becoming darker, and you see this Montgomery's glow in small tubercles like thing around the nipple. All this develops, but the milk production starts in second trimester. Slowly, colostrum starts developing. It is inside. It is nicely stored inside, like in a fridge. It doesn't. Some people it might come out. No, just because it comes out, we don't have to be worried. But if it consistently comes out, like I said, these are the people who can have a preterm delivery that only shows that progesterone might be low. Then don't start stimulating it. If you start stimulating it, you can end up preterm. So once these things start happening, like first thing you told me was eating for two. That's a nonsense thing. Remember that. Baby
Yes.
is a parasite. Parasite will eat irrespective of whether you eat or not. You eat for yourself how much your stomach can eat and at frequent intervals. Make it short, frequent meals whenever you want. That's what you need to look at. Not like overeating. And average weight gain we want in pregnancy is 10 to 12 kgs, not 20 to 25 kgs that you cannot lose afterwards. Sudden increase of lot of weight also can lead to hypertension and diabetes, not just them. That's why we don't want you to overeat, eat a healthy diet and intervals. The colostrum milk which starts producing in the second trimester is well formed. Your breast starts becoming more bigger and bigger. So you don't have to worry about whether it is getting produced or not. It is there. It is stored in the second trimester.
So, why nipples and areola darkens?
Yeah. This again because of the hormones and what is going to happen around in the pregnancy. Nipples start becoming bigger in the third trimester, but areola starts getting darker in the second trimester. That's called melasma. It is something like linea nigra. You see a weight line. It's all because of the estrogen. Estrogen is one which stimulates the MSH and all these changes start happening. So it become darker. You don't have to worry. That's the normal pigment of the skin there. So that only shows that there are ducts inside which are getting filled up. That is where the milk which is produced inside the breast gland will come there and get stored behind the areola. Areola margin is the one which is the fridge. Production is inside there. The storing is near the areolar margin. That's where the ducts are seen. Then the duct starts coming out through the nipple, and nipple is the starts becoming bigger in the third trimester. So everything is related to the hormones. Your skin gets stretched, and in the third trimester, you also see the stretch marks starts getting. Some people will start getting stretch marks. So you can start applying a lot of moisturizer on it, and you can have dry skin if it's getting stretched. You can have itching when it happens. So all these things happen. So when they come to us in first trimester, we start looking at the nipple because if it is retracted, you might have to start forming the nipple right from the second trimester itself. So we have to keep a watch on how the nipple is. Is it flat or inverted or retracted?
So moving on to the next one, as we know, there are something called as glandular tissues.
Yes.
So will insufficient glandular tissue affect breastfeeding?
See, insufficient is not a question at all because there will be sufficient thing. Because as long as the pregnancy has gone for 9 months, the hormones were in a peak, and they will definitely cause hyperplasia and hypertrophy. Like I said, it is our brain and the thought which will inhibit it. So it is our stress and our thing that it might not come. Last time it did not come, or pain of delivery. Okay, and the painkillers, they are the ones which will stop the lactation from happening. Because, like I said, it's a nexus is going to happen. The brain controls everything. Once the baby starts suckling, there'll be signals which will go from the breast tissue through the nerves to the pituitary. And from there, oxytocin secretes. This oxytocin will go back and act on this, like I said, fridge, that refrigerator which is there. That is myoepithelial cells. That muscle contracts, milk gets ejected. So this is the cycle which happens. And when I said oxytocin, it will not decide I'll only act on breast. It will go back and act on uterus also. So your uterus comes back to normal size very fast. So the more you breastfeed, your tummy is going to go back fast, and uterus is going to become normal fast.
So to come back to your zero size, you should breastfeed, and
Yes.
breastfeed.
Yes.
So now it's time again to come back to our mommy's questions. There's a question that I am in my first trimester and facing a lot of nausea and vomiting, due to which I feel the food intake is not sufficient. Please advise.
The first thing is when we say 10 to 12 of weight gain, yes, it is in first trimester 1 kg at the most, or people who lose also. So don't worry. Second trimester, it is 5 kgs. Third trimester is 5 kgs, where we look at every 2 weeks, 1 kg weight gain. Okay, this is what we are looking at. Now, when we say that, first trimester, we see people losing weight also. Now, why is it you're having vomiting? It is because the exposure of HCG, the hormone in your body for the first time or second time, HCG cut. There's a cross reaction with the TSH which has there, that is in the thyroid also. So you have more of vomitings when you have double dhamaka, again that and this. And if you have vomitings, we are not worried about your weight gain at all, but we are worried about electrolyte imbalances if you're not being adequately hydrated and your feed is not up to the mark. So what do we tell people when you're vomiting so much? Try to decrease your liquid and increase your solid intake. Dry biscuits, dry things. Every 2 to 3 hours. People think that I'm vomiting. We take in liquids. Liquids cause more vomitings. The second thing is, if you take acidic, movies में दिखाते हैं आम लियो अच्छा रहता. No, all these things are more acidic. It will cause more vomitings. So no citrus fruits, no amchur and almond, all that things. So you avoid all this. And if you have to take small, short, frequent meals, little by little, and dry things, and whatever you gain is enough. And there are medicines. Don't start thinking in your brain, I won't use medicine, I won't use medicine. If you end up having electrolyte imbalance, your ketones will increase, and that can lead to a lot of problems. Your potassium can come down. That leads to a lot of issues. So what we need is having a balance in our body. So always talk to your doctor. We have category B drug medicines which are safer in pregnancy to stop your vomiting, and then please take them. Nothing.
Nothing to worry about. So there are a lot of myths regarding the food. What kind of food we should consume while pregnant?
Yeah. First, I tell them, people are so worried about मैं ये खा सकती, वो खा सकती, ये लेना, वो लेना. Whatever you feel like you eat. But only thing is balanced diet, protein, carbohydrate, and the thing that is 60%, 20%, 20%. Why is it important that you eat what you want to eat? Just because something is healthy, you are topified with it, and you cannot eat. You're actually depriving you of the healthy diet which is there. Only thing I always tell my kids, don't eat outside food, because we don't want lose motion and food poisoning. Second, definitely I want you to drink milk. If not, take a protein powder with water or milk. Third, calcium is important. So we are giving you supplements. So don't worry. अब ये खाना, ये खाना, ये खाना, ये अगर नहीं पचा, you are going to vomit with that. What is the point of your putting yourself into that? So eat healthy diet. See that you don't vomit. You take what you want, and you can sit with your dietitian and discuss with them. This is the diet I like. Please tell me a balanced diet with this particular diet. That's it. You don't have to push yourself into doing things which you don't like. But take the supplements. Yes. And all of you out there, all the moms out there, please understand the difference between supplements, medicines, and replacements. What we give in for thyroid is replacement, which is necessary, absolutely necessary. So you cannot miss it in pregnancy. Supplements is what your body needs, which might come from outside, might not come. That's when it's vitamins, calcium, iron supplements. Then medicine is if you develop any infection in pregnancy, okay, like it might be vomitings, it can be respiratory infection, urine infection. We give a limited time period medicine for that particular disease. That is medicine. You understand the difference, then you know the thyroid is a must. Supplements, it is better to take whenever we tell you in pregnancy, but medicine only if the disease is there.
Definitely. So I'm sure all your queries are answered in a right direction, a very positive manner. Even if you have any confusion, feel free to please use your comment box. Coming up as the next question, ma'am, I'm not pregnant, but I have sore and flaky nipples. Is it common for a woman who is not pregnant?
Yeah, it is common. Sometimes it's called eczema. It is an allergic reaction to something that you're putting. It can be to a soap, it can be to the bra which you are wearing, or anything. So please make a note. What is it which is precipitating more flakiness? So you understand that and avoid all that. Start wearing only cotton bras and something which is not going to be allergenic, and start using lot of moisturizer. Usually these will set in. But if it's becoming more, and then you will have to use anti-eczema ointments, meet a dermatologist, and then still more, then we send the flakes for under microscope examination to understand what is happening. So I would not say it is common, but it is
It's
heard of. So don't
yes.
worry. There is treatment.
There is a solution for that. Nothing to
Yes.
worry.
Yes.
Yes, ma'am. Moving on to the next one, ma'am. My doctor suggests to go for IVF that I have low egg count. Should I have to wait for some time or should I go for that?
See, if that's what this is a similar question to what we spoke about AMA. Like
Yes.
egg count is less means agar antral follicle count is less. See, a lot many factors depend on whether to go for IVF or not. One male factor, agreed. The tubes are blocked, agreed. Okay. The rest of the things we look at your age. If you're more than 35, we don't want you to waste any more time. Unexplained infertility. We have tried your regular treatment and IUI, nothing is happening. And if AMH is low, it is not a rule, but definitely, again, time, biological clock is important. So sometimes we do advise you to go. But like I said, think about ovarian rejuvenation also. And if the tubes are good and rest of the cofactors are good, then you can try. But waiting for another 6 months will not improve your egg count. That you have to understand. Just do something about it.
So next question is if we see spotting after confirming the pregnancy, is it a
Mhm.
sign of any miscarriage?
It needs not be a sign. It only is warning you. What we call it as red flag. So it is warning. Why is that warning coming? What we is it because the progesterone, the hormone of pregnancy, like I said, hardly a dal chawal hai. Baby ke liye it, so if it is less, we have to give it from outside. That's what we have to support it for the first 3 months. First 3 months, baby depends on the mother for the hormone. After 3 months, first trimester is over, 15 weeks, it's 50% on the mother, 50% placenta starts taking over. From 16 weeks till delivery, it is solely baby. The baby parasite blood supply from the mother, and it produces its own hormones, everything. Unless in the last trimester, the mother develops hypertension, blood. The spotting means either first trimester spotting, so, or baby might be abnormal that we do not explain, or if slowly the placenta where it's sitting can be low. Now, whatever we do, even we support the pregnancy, just if the baby is healthy, God has a way of away unhealthy pregnancy. They won't continue. So it's all or nothing phenomenon. Don't think too much. If the baby is not healthy, we don't want such babies. We want healthy baby. Healthy mother is what. But
Yes.
if the baby is threatened, and we support with prenatals and progesterone supplementation, and usually
So the next question is, what are the chances of getting pregnant if someone is diagnosed with premature ovarian insufficiency?
That is the same as what we've been talking about AMH less. So when AMH less is decreased ovarian reserve is what we talk. So we do a daily hormone FSH less than what we do is before 8 o'clock. Anything more than 12 FSH low reserve means the chances will come down. But AMH low, FSH low, definitely more than 12. You have only two options. One, go for ovarian rejuvenation using autologous bone marrow stem cell transplantation and PRP, or else you can go for oocyte transmission program where somebody can give the egg and then you can become pregnant and you can have your baby. So if you are so stuck with your own oocyte, you can go for ovarian rejuvenation.
So, mothers, if any one of you face network issue and you can't hear us, please do let us know through comment box. Right. So moving on to the next and the final stage, that the third trimester. Every 15 days you can't fit in your same clothes. There's sleepless nights starts from here, and that's the third trimester. So the first question that's coming from there is, when do a mom starts producing milk? Can we see droplets of milk or colostrum during this period?
Right from second trimester, you can see drops of cholesterol.
Okay.
That need not be a norm, but just because it happens, you don't have to worry. Go and get yourself checked with the doctor. Everything else is fine. That's just a signal that milk is getting produced and we are keeping it safe in the blood. So nothing, again, nothing.
Nothing to worry, definitely
But
not.
sometimes associated with it, if the uterine contractions are coming, then we give something like, progesterone supplementation or the uterine tocolytics so that you don't have a preterm labor. That is what we look at.
Yes. So, ma'am, there are some women who literally changes their size in numbers, like from a cup to they become DD cup.
D.
There are some of them they stay from A to B only, and there are some where there is not at all any change in the size of breast. Is it normal?
If 5 fingers are different, never try comparing your one within your body only 5 fingers, and our hand and somebody else's hand is different. So don't ever compare. For your baby, how much is produced by your breast and your body. So that's God's of nature. That's how the ecology ecosystem works. So don't start comparing. And that thought and that negativeness, that parental stress will definitely inhibit the production of the milk. So don't think about it. जितना चाहिए उतना produce हो जाएगा and time. So it is like how they work when they are supposed to work is what matters, not before itself. So when their baby it is getting produced and the milk comes out, that is then enough. But majority it will increase.
So, ma'am, is it normal to have breast pain during pregnancy?
Yes. Breast pain during pregnancy, like I said, because the breast tissue starts increasing in size and the nerve, vasa vasorum, and the nerves get stretched. It is like, you go into hot summer, your breast and the head dilate, you get headache.
Right.
Okay? Oh, that's because that breast then you get headache. You can have feel dehydration, nausea, you can have also. All this is because of vasodilation. The same way, when the breast starts getting engorged, then you have these blood vessels which are dilated. You are going to have soreness in the breast. So if you just wear put supporting bras, that goes a long way because the heaviness of the breast, gravity also put a stress on and the strain on the breast. So support your breast. And if the progesterone is deficient, your doctor progesterone supplements, and usually breast pain will come. Now, saying that the pre-oxygen radicals, which are seen quite often in pregnancy, can cause calf muscle pain and the breast pain. So, vitamin E supplements, if it is needed, give it. Magnesium deficiency is also possible. So, if your B12 is good, also can come. So, supplements is the way to go for.
So, ma'am, is what kind of pain is normal, and what kind of pain where a mother should go for expert guidance when it comes to breast pain?
First, when it comes to breast pain, first thing is don't have to sit at home. Go to the let the doctor,
Okay.
and the soft, nothing else is there. No pricking or anything, no redness in all these factors which we see, which is mastitis or any pus which has formed, or any lump which has become any lumps or disease. All those. And once one week doctor, then you can be nothing is wrong. So there's no harm done. You're anyway going for an antenatal checkup to your doctor. Same, tell your concern, doctor examine you.
Nothing to
And
worry.
blood color which comes.
Ma'am, there is a ma'am mother who's saying that your voice is not clear, even a
I,
little.
I
Can you
don't know.
I,
I'm so
no,
I
your
never
network.
this.
Ma'am, just check your network for once.
My network is showing all nice
All fine, right?
achas,
Yeah.
achakasa lines.
Acha khasa light, right. Okay, so the next last question from the third semester is it safe to massage your breast during pregnancy?
Let me tell you one thing. We usually not do not advise you to massage, because when you start massaging, that again, like I said, signal goes to the brain. The brain will not know the difference between baby sucking and you massaging.
Okay.
Okay. So too much of massage can actually cause stimulation and then lead to oxytocin release. Oxytocin, like I said, will not show any partiality. It will go and start affecting the uterus, and contractions will start. So just
Right.
apply moisturizer, and if your nipple is retracted, you can just make your nipple once a day, twice a day. That's enough. Don't do too much of massage, which can precipitate preterm.
Stay with us. I think there is some network glitch.
Now also it is there.
Yeah, it was just for a second. Now I guess it's better. Okay, so now moving from the third trimester, we are starting with a beautiful phase where the 9 months wait is over and you have that little one in your arms.
Right.
So, ma'am, how the breast changes after pregnancy?
Right. It breast changes in the sense it is almost the same, or it becomes even more fuller. And then as the thing happens as it goes, depending on the cycle, either it gets engorged if you're not feeding on time, or it gets completely softer and empty once you feed the baby. So what you need to do is then just before the delivery, your nipple becomes larger, the openings become more clearer. So you should know how to latch. There's always a difference. The problem, people think the milk is coming from the nipple. No, milk production, which has happened in the breast tissue, is stored around the areola. So when you press, if you press the nipples together, that means you're stopping the milk from going out. So you have to press along the areola back towards the chest wall, means you're pressing the storage area, where from there from baby sucks into that through the ducts, then through the nipples it comes. So learn the right technique the right way. Then when you start feeding, if the breast becomes too much, if after the baby drinks the complete milk, your breast is still engorged, please remove the milk.
Yes,
That is what
very
is
important.
important. Don't keep it inside. You can store it, give the baby later. But if you leave it, they can form the galactoses, or it can form lots of lumps that they can get infected. And next time when you're feeding, they can itself stop the milk from producing again because of the pressure. Then removing that becomes very difficult. Then you'll have to go to the doctor, they'll give you oxytocin inhalation and then remove it.
So that was really informative, ma'am. I'm sure a lot of mothers, they simply think that the milk comes out of that nipple rather than.
Yeah.
So, ma'am, what is the letdown reflex?
See, like I said, when the baby starts sucking, the sensation from the nipple goes to the brain. Brain stimulates the production of oxytocin from the anterior pituitary. From there, from posterior, from there, that oxytocin will come and act on the myoepithelial cell of the ducts, and it contracts. When the myoepithelial cells contracts, the milk comes out. That is the ejection reflex, what we also call it as ejection reflex. So you have formation, you have storage, then you have ejection. So that is the thing, the whole tingling sensation when the baby sucks and then the milk starts coming out is the letdown.
So, ma'am, next question: does our cup size decides our quantity and quality
No,
of milk?
Not at all. We always talk,
This is the biggest myth all around, that if you have small breasts, you'll never make your baby full.
see, छोटा, that is छोटा packet बड़ा धमाका बोल के पहले से हमको बोला गया है. Remember that?
Right, ma'am.
जितना बच्चे को चाहिए उतना प्रोड्यूस होगा and that will be ejected.
Definitely, ma'am. So, ma'am, how to take care, a good care of your breast after pregnancy, during breastfeeding, and later on?
See, the things which we are worried after breastfeeding is the infection and the pus. That is what we call it as mastitis and
Yes.
abscess. Now, baby's mouth is full of infection. We have to understand that. We are not brushing the baby. Mouth anytime full of GI tract infection, it is normal for the baby. Now, the same direction how the milk comes out, the same direction the infection can also go back inside. And
Yes.
once it is inside, you're having milk which is there, which is like culture media. So the infection grows and grows inside. So we don't want that to happen and form pus there. So what is important is before feeding and after feeding, always clean the nipples. That's very, very important. The second thing which is very important once you start cleaning the nipples and everything is, like I said, empty the whole breast after the baby feeds. Both the breasts. See that it will get filled up very fast. Within 3 hours, within 2 hours, or even within half an hour, the breasts are full again. The more it gets emptied, the more it gets produced. So that is, there are two things if you do, and not allowing the sagging means either it's like Abdullah has to go to Kua or Kua has to come to Abdullah. Kua to nahi aayega, so Abdullah has to go. So breast,
Yes, ma'am.
hum log chukna nahi. We should get the baby up. So put 2-3 takia under on the lap and get the baby up and use it straight and feed. That is the first thing you all have to do. If you don't do that, your spine, there's a backache which will come because lordosis, which happens in pregnancy because of the relaxing hormone, is not make the joints very still soft until they become stronger with your exercises. You have permanent backaches which will come. Your chest wall pain, your calcium deficiency will come. So take a lot of milk, lot of calcium, and feed the baby, and let the baby come up. And breast support bras. When you're buying the bras, don't take the wire ones. Unwired ones is what you should look at. You should not allow the breast to be discomfortable. So I am not so much in favor of these particular bras where they come out, and because it is more the space that at least it should be quite a opening should be good enough. If it is a small opening, the baby can get suffocated by itself by not being thin. You should have a good enough opening where your both the fingers can attach onto the areola and latch, allow the latching of the baby. Then everything is fine. But clean, empty the vessel, clean the vessel, empty the vessel, and then cover the vessel properly. These are the things, and let somebody who is drinking come back to the vessel. These are the things you have to.
So moving on to the next one, ma'am, as we all know, is colostrum and the milk. These are the only two
Right.
type of milk,
Right.
but that's not true. Mature milk, fore milk, and hind milk. These are the three type of mother's milk. Ma'am, can you just explain what is mature milk? What is
I will differentiate little differently. Colostrum, transitional milk, mature milk. In the mature milk, fore milk, hind milk.
right?
So, colostrum is full thicker and tastier. Color will be little more this thing and everything, all those things, stickier and all that. It will be lesser in quantity, but high in protein and everything. It will come for the first 2 days and it can come in pregnancy also. 2 to 5 days, around 2 to 5 days and lasting for 2 weeks with a transition milk, where slowly it becomes thinner. It can become slow bluish, little more bluish, and start getting all the fat and slowly into it. Then as the fat content of the milk increases after 2 weeks, you have the mature milk. In the mature milk, you have fore milk, which is the initial part of 10-15 minutes. Then you have the hind milk, where it is a fat which is also coming into the milk, which is the last minute. So where we talk about only proteins, antibodies, and everything, they'll all be the rich in colostrum. Slowly in mature milk, we have all these, including antibodies, everything starts coming off, including the whatever we talk about, the antibodies to protect the baby against all the diseases and protect the mother from all the diseases. Like I say always, the breastfeeding is not just for the baby, it's for the mother. For your periods to come back normal, you lose weight properly, not get the bone osteoporosis, endometriosis, and ovarian and breast cancer. And immunological disease also will come down. So remember that the mature milk, foremilk, hind milk, whatever it is, just feed re. Very important.
Yes, ma'am, definitely. So, ma'am, there are a lot of questions, the same questions, I think 3 or the 4 mothers asked. Till what age they should be breastfeeding a child?
Each, what about, can you repeat?
Ma'am, the age of the child, till what age they should be breastfeeding?
We want is 6 months, like we always talk. Now, there is a just little difference of opinion between me and pediatricians which go on. They want you to feed till 2 years. I would say 1 year is the time which is enough where we start feeding off from 9 months and 1 year. My points is very, very clear. As the mind, the thought process of the baby starts increasing and all, it's very difficult for you to wean once it is after 1 year. Second, from 6 months onwards, we want baby to not just drink milk and fill their stomach. We want other things to be taken by baby. And babies are lazy like we are. जो easy मिलेगा वही ले लेंगे. They don't want to work hard for anything. So night अच्छा खासा milk मिल गया, पेट भर गया. Then what else? They won't eat the rich food which you are going to give. We need rice, we need other things, whatever you want to give, supplements and all. So after 1 year, I still feel that they should eat the staple diet, normal staple diet, the milk which we can give, the regular milk, or anybody gets it. But first 6 months, it's exclusive breastfeeding is what we are going, because you'll have antibodies and vitamins and everything, protein and iron, which is not available anywhere, and everything, whatever you want to say. But after that, I think 1 year is something you get giving slowly. From 9 months, you can start weaning off. Once the Freudian complex also can still develop after 1 year. So there are so many reasons I still feel that after 1 year, time to stop. Unless we are lazy that we just want to go around, we don't have food to give. This is sterile food which we can change.
Right.
No, there's nothing right or wrong. It is your convenience, your comfort, which you want to give it. But see that you want to give it, give the normal regular diet and uske baad diyo.
Yes.
Yeah.
So,
Don't
taking up the last few questions from the post, there's a mother who's asking, ma'am, may I know why should the couple wait for 3 months after vaccination for pregnancy trial?
see, you don't have to wait. Actually, you don't have to wait. But as the newer vaccinations are there, we really don't know so much of information starts getting poured up and poured. On one side, when we are telling you're trying for take your vaccine in pregnancy, take your vaccine in lactation, take your vaccine. There's no logic in telling wait for 3 months. You can go for pregnancy. There's no harm in it.
Okay. So, there's a mother who's asking why a mother feels so hungry while breastfeeding.
Remember one thing, breast milk kahan se aa raha hai? It is not coming from trees. It is not coming from hava. It's coming from inside your body. Your body bones are giving the calcium which it needs, and your fat is coming from your thing, and proteins are coming from inside your body. Whatever you eat doesn't go to baby as dal chawal, like I said. In the uterus, it goes as progesterone and estrogen. Whereas when it comes to, and the blood supply, when it comes to lactation, it goes as milk. So milk is the blood which you are giving to that. So all the ingredients, protein, the electrolytes, the water content, 80% water content, iron, antibodies, everything your baby is getting from you. So naturally you're getting depleted. That is the reason, as long as you lactate, you should and must take supplements. And if you are taking 550 kilocalories more in pregnancy, during lactation, you need 600 kilocalories, more than what you used to take in pregnancy. So remember that and take it.
Ma'am, why hair fall is common in first trimester?
It is not common in first trimester, it is common after delivery. In the pregnancy, because of supplements and the hormones which we produce, hair starts growing. But afterwards, it just sheds. It is like telogen effluvium. Okay? But again, it comes back. This is all the cycle which happens because of the magic of the hormones. Nothing to do with you or anything.
So moving on,
I think
I think there are a lot of questions still coming up. We'll definitely would like to take that, but we also have some time foundations.
time.
Yes, ma'am. So as not many people know that Dr. Anagani is not only a doctor, but as a woman parallelly, she keeps working with a lot of NGOs, her own co-founded NGO Pratyusha Support. She initiated advocacy campaign Sayush a Perfect Women. She continuously is working for women empowerment, women health, for child abuse, and lot many such issues. Ma'am, I would like to just have your 2 minutes on the topic normalize breastfeeding. This is an
Yes,
initiative by our platform Nutrizoe, which we are taking up, and I will definitely love that आप हमें इसमें support करें और say
definitely.
something like it's very important for Indian mothers to understand that it's absolutely normal.
It is normal. Why are we even talking about it is something which always surprises me. There are people, if you go towards the villages and all, it is normalized already. They take it for normal. I think with the false sense of this new age and all, we have made it a thing to talk and to give in the public and all. We are thinking twice. No, it is normal. You want to have some shawl to wear, that's your choice because of your modesty, what you want to say. What
Yes.
is normal is normal. It is like breast milk, whether you want or not, is produced the minute the baby is born. The progesterone and estrogen falls and the prolactin comes and production happens. You cannot stop it. So what is it is as natural as the natural cause of you feel your bladder is full, you want to pass urine. You just go and pass urine. So it is like that. So let us say that normalizing menstruation, talking about menstruation, normalizing, talking about pregnancy. Once you're married, everybody starts asking you when are you going to get pregnant. That is normalized so much without even talking about anything else. We normalize it. And lactation is something which is a mother's pride, I would say that,
Yes, ma'am.
and it's proud to wear it on our shoulder. The baby and the lactation, we have to normalize. It is normalized. That's it. Full stop. Period.
Yes, ma'am. We can feed wherever, whenever we
We
want, and no one is there to question us.
whenever baby wants.
So, all the mothers watching us, please go visit our page. And we have done a very small video where the mothers are actually feeding the babies and they are trying to show that it is absolutely normal to breastfeed wherever, whenever your baby demands.
Yes.
Dr. Anagani, thank you so much, ma'am, for taking out your time from such a busy schedule, which was such an informative session. I'm like, I am very sure all the mothers who have joined us now and will be watching our show later on, they will get so much information from all our talks.
Thank you. It's a pleasure to be part of something which I get
Pleasure
paid.
is all mine, ma'am. Thank you so much. Thank you, mommies, for joining us. Join us tomorrow with our next expert, Dr. Ifat Yashmi. She is a lactation consultant. She will be talking about success with breastfeeding. Thank you so much. Have a nice evening.